Like and subscribe and click the bell icon to get new video updates.
3 new Omicron subvariants in Australia. 3 new Omicron subvariants have reached Australia, and health authorities say people who contract the virus should wait 3 months before getting their next COVID-19 vaccination. Associate Professor Stuart Turville from the UNSW's Kirby Institute says Omicron subvariants BA.2.12.1, BA.4 and BA.5 have been detected in Australia. Authorities are warning this winter season is likely to see a spike in COVID-19 cases and flu as restrictions which have suppressed the circulation of both viruses are phased out. The latest advice from the Australian Technical Advisory Group on Immunisation recommends people wait 3 months after a confirmed COVID-19 infection and then receive their next vaccine dose as soon as possible. The advice, issued last week, applies to all people and for all COVID-19 vaccines. Professor Turville said the severity and transmissibility of the new Omicron subvariants had yet to be determined. The arrival of Omicron BA.1 and BA.2 were marked by their ability to significantly evade a previous antibody response through past infection and/or vaccination, but the impact was less severe. The new subvariants BA.4, BA.5 and BA.2.12.1 are likely to displace BA.1 and BA.2 in Australia. We will need to study this over time to see if their advantage is one of fitness transmissibility, and/or their ability to be more slippery to existing antibodies, Professor Turville said. As with all variants, the key parameter to watch is disease severity, and this data takes time to accumulate. There is still a lot about this virus that is unknown, and there are many paths it has the potential to take. Western Australia meanwhile reached a new peak in daily cases, less than a week after removing the vast majority of its public health restrictions. The state recorded 9782 infections, exceeding the previous peak of 9754 more than a month earlier. Latest 24-hour COVID-19 data. UNSW 11,939 cases, 21 deaths, 1510 in hospital, 68 in ICU Victoria, 10,779 cases, 11 deaths, 473 in hospital, 25 in ICU Queensland, 7668 cases, 8 deaths, 504 in hospital, 21 in ICU Tasmania, 1078 cases, 1 death, 50 in hospital, 2 in ICU Northern Territory, 399 cases, 37 in hospital, 1 in ICU South Australia, 3591 cases, 12 deaths, 221 in hospital, 11 in ICU Western Australia, 9782 cases, 2 historical deaths, 242 in hospital, 10 in ICU. Australian Associated Press,